So hello everyone and welcome to this month's vlog. And the topic for this session is going to be around AHS Provincial Clinical Information System. So I'm really happy to be able to say that we're going to be rebranding that name to be calling it Connect Care. It's going to be an electronic tool that's going to be accessible to patients and families, as well as our healthcare providers, that will allow them online access to all the healthcare information that's needed to provide quality and safe care for patients. So I'm very excited today because I've got Ryan Magnuson with me, who's a patient family advisor who I've gotten to know quite well. And Ryan's been a tremendous asset to the organization. He's volunteered on numerous different policies and programs, and we're very privileged to have Ryan be partaking as a patient advisor for us for Connect Care. And Barb Cathall, who's our Senior Program Officer for Clinical Information Systems, and delighted that you both joined me today. So I wanted to maybe, Barb, ask you the first question, which is an update around the CIS or Connect Care, and maybe just letting us know what's been happening.
Sure. So currently across Alberta Health Services, we have over 1,200 applications being used in various clinical areas, excluding all the paper-based tools that we use. With the CIS program, we're trying to slowly reduce the number of systems currently in use, and with the implementation of Connect Care, we will have one system that will support patients and families across the province.
Ryan, what do you think about the contributions of patients and the importance of patients' voice in Connect Care?
Oh, it's very important to have the patient's voice because they're the ones that are actually experiencing the problem, and a lot of times with the vast amount of people that are taking care of you, not everybody gets the same information. And I noticed that we really needed a full computer system that would give the information and communication to providers and patients so that they can work together and deal with the medical issues there.
If you were using the patient portal and using the system the way you think that patients and families should be using, how do you see that working for you? Can you give me sort of an example? I think
it'll be great because you'll be able to communicate with all the different providers that you look at and that are along your case. You'll be able to actually track a referral to a specialist and see where you are in the process, and everybody in that process gets the same information. So there's little room for miscommunication and disinformation in that scenario, and that will improve the quality and safety for sure.
So Barb, what do you think about the advantages it would have towards healthcare providers?
Our healthcare providers will have consistent tools to use with patients and families. They will be able to see a consolidated problem list and understand the patient perspective. We'll be able to have clinical knowledge support as they're providing care, and we'll also eventually be able to have data about our health system that we don't currently have.
What kind of benefits do you think the CIS will provide to patients?
For sure, safety. Patients will be able to communicate with all their care providers. It will streamline the process of referrals. So they'll be able to see how they work their way through the system. And it'll be available to all the care providers as well as the patient. So they'll be really working as a team together.
Thank you for that. And you know, it takes commitment and it takes committed leadership from everyone, from patients and families to our staff and to our senior leaders. So on behalf of all of us in AHS, thank you so much for your leadership in helping us advance this work. I want to thank you for your attention today at today's vlog, and I'll look forward to talking with you next time. Thank you.